and welcome to PHI, Public Health Impact. I'm Phaedra Corso.
And I'm Cham Dallas, and today we're going to transport you to the epicenter of an emergency response.
Well, Cham, you certainly are an expert in disaster preparedness. Why don't you tell us a little bit about your institute?
This is the Institute of Disaster Management, and we have the responsibility for preparing hospitals and nursing homes, and in fact all the coalition of groups that have to respond to a mass casualty event here in the state of Georgia and across the country.
And what are we going to be seeing in today's episode?
Well, ever since September 11th, over a decade ago, we've had to really change the way we are going to respond to mass casualty events because they're much more likely now. And so these are not just man-made events, but also natural events. Today, we're going to prepare and respond to a simulated tornado event here in Atlanta, Georgia.
How very appropriate for us to be doing that, because we've just experienced a tornado earlier this year, right?
That's right, and in fact, a couple of years ago we had a big tornado go through downtown. It even hit the Department of Public Health downtown.
So where exactly are you going to be?
Well, we're going to be in Kennestone, is the hospital you will see on this episode. But what we're doing is we have 40 hospitals and a coalition of emergency management groups all working together all over Atlanta. You will see the response at one hospital.
So let's remind our viewers that this is just a drill, and we'll see Cham and his colleagues in a few moments as they prepare and they deal with the simulated tornado drill.
So Kurt, tell us about the nerve center of action here.
So what we have is our Emergency Operations Center, where all the section chiefs from the various branches of the incident command system are going to be located. They're going to be receiving information not only from internally within the hospital, but also externally from the community, as well as the other hospitals within this region.
So the decisions are being made here in this room for the response in this whole region.
Absolutely. All strategic decisions, mainly for the hospital, are going to be involved in this command center here. We also have a mobile command center that's set up outside here at Wellstar Kennestone that's going to be receiving all the regional coordinating hospital information for the entire region and all of Metro Atlanta.
All right. I see you've got, everybody's wearing little bibs or something on. What do these things mean?
All right, so everyone in here has an identifying vest on, and the reason for that is so that we know exactly who they're going to report to. So when staff from the various departments come to the command center to give their reports, they know exactly who they're going to, and if we have to relieve our command staff, then it's easy to change a vest and a title rather than a name. Because of staff turnover rates and because of things that occur within the hospital setting, it's always important to go by titles, especially when you're in a unified command and you're going to be communicating with community partners as well as your internal staff here at the facility.
Where are we in this exercise? Tell us, a tornado has hit, and we're starting to get information, but and it's moving in real time.
Yeah, so we're currently in just the watch phase, so we haven't even progressed to the warning phase. So this actually started yesterday. We started receiving some National Weather Service alerts, but we are currently in the watch phase of this exercise. It's going to progress to the warning, and it's going to progress all the way through to some facilities being damaged here within the region.
Tornado warning is in effect. This is the drill.
Now we're going to go to the district level of response for a mass casualty event. And for that, we go to Pam Blackwell. What district responsibility do you have?
And in the district, we're responsible for emergency support function number 8, which is health and medical. So in this event, which is a tornado has currently hit Douglas Hospital and Paulding Hospital, we have staff here at our mobile command unit behind me and public health staff at the Douglas Emergency Operations Center to work with the regional coordinating hospital, Kennestone, to ensure that we have enough room to place all the patients, which is the medical aspect of what we do.
So your responsibility, even though you're located here right outside the hospital that we've been focusing on today, you're actually responsible for the response for many hospitals, and you're doing it from this trailer right here.
That's correct. I'm on an 800 megahertz radio system, which you see my headset, and it's a temporal headset. So I'm hearing what they're saying through my temporal bones, but I can also hear you asking me questions, which is a very unique situation to have these temporal headsets.
Well, that's why we came to you, Pam, is because you're the one that actually coordinates this between many different hospitals. Tell us, so on the roof of this particular mobile command center, I see you got your ham radio operators to keep your communication going.
That's correct. If the 800 should fail, if all other communications, if wireless goes down, the cell phones go down, landlines go down, we can still communicate with our ham radio because they're on a whole different system and it will not go down. So they have ham radio operators at all of the affected hospitals and they're communicating with them currently.
So Pam, whenever decisions are to be made about moving patients from one hospital to another or from a scene to a particular hospital, that decision's made at the district level?
Well, no, the incident commander on the scene will make the decision about the movement of patients. Typically, that is the fire department, and the fire department has assumed command at Douglas and Paulding Hospital. We work with the regional coordinating hospital, Kennestone, and their representative is here in our command unit, and he facilitates what patients are going to what hospital with the incident commander.
So right now, at the stage of the exercise we have right now, one of the hospitals, in fact, it's the hospital that you are communicating with, has been hit by a tornado, and we're having to actually extract people from that hospital.
Correct. I'm hearing Douglas General currently with what's going on there with fire and EMS, and very soon we anticipate that Windy Hill is in the direct path of the tornado from the National Weather Service. There will probably be another touchdown. The patients from Windy Hill will probably come to Kennestone.
Okay, so what we'll now see in the real-time unfolding of this exercise is because of these patients have to leave the other hospital, they'll be coming here.
That's correct. Some will be going to Cobb Hospital, some will be coming here to Kennestone, and it's very difficult situation, as you can imagine, to move patients, critical patients, out of a hospital and to another hospital. We have to be able to track those patients as to where they're going, what their medical status is, and we also have to bring their medical records with them.
Well, this is exciting. It's an exciting world that you live in, Pam. Thank you for telling us about this, and thank you for the work that you do in coordinating between these different groups in very difficult circumstances.
Well, we're very pleased to do it, and exercise makes perfect. And, you know, we have done this for real a number of times. I think all of our partners take this very seriously. Since we've done the Katrina response, the Rita response, the Haiti response at Dobbins Air Reserve Base, the floods of '09, and of course H1N1.
It's a dangerous world out there, but we're glad you're here to help us. Thank you, Pam.
Thank you.
Dozens of volunteers and actors played the roles of victims and patients for this exercise. Each actor followed an individualized script, providing realistic challenges that medical personnel had to identify and treat. Moulage, or the art of applying mock injury makeup, provided additional realism for the exercise.
All right, we're going to triage them into triage 1 to try and see if we can get control of this bleeding and decide on OR or not. Here's your sheet. Thank you, sir.
Sir, can you tell me your name?
Dana. All right, sir. Lift your feet around.
Airway.
Okay, here we go. There you go.
Airway's clear. Kelly, can you face the trauma team, please?
This is Dr. Barry Renz on the front line here in the emergency room. Dr. Renz, how important is it to exercise large numbers of people coming in at one time?
It's very important. It's important to do this several times a year so we know what our capacities are to handle surges of injured patients. The most important thing for us to do is to immediately decide which patients need what life-saving maneuvers as they're coming in. The first thing we received here were what we call the walking wounded, the patients who got here before we even knew that there was a disaster. They jumped in their personal cars and they drove to the nearest hospitals, and we saw them. And then after that, we get a wave of patients who are more severely injured, who couldn't walk here or drive here themselves. And there's all sorts of things. There's pregnant patients with injuries, there's patients with bones sticking out, there's tree limbs and glass sticking out of people. We have to triage the patients. We have to figure out which ones need what in what order in order to prioritize and try to save as many lives as we can.
You're pulling a lot of staff in from all around the hospital.
That's right. We have a disaster plan here. It's a written policy for how we handle these sorts of situations, and we pull people from all the different specialties and subspecialties in the hospital. So we have people here from OBGYN, we have nursing, we have radiology, we have techs from every department, we have trauma surgeons, we have emergency medicine physicians, we have everybody on standby.
Well, now in front of the emergency room, we have Bruce Powell, who's Director of Emergency Preparedness for the Keystone WellStar system. Bruce, tell me, this is where the action all is. We have patients coming in, seems like by the dozens here. What's going on?
We've gotten reports of 2 of our hospitals in the region N RCH, that were hit by a tornado. WellStar Douglas Hospital and WellStar Windy Hill Hospital received a direct hit, and we're having to evacuate. They're no longer able to sustain care at those facilities, so we're evacuating those patients to this facility and to another within our region.
To transfer patients from one hospital to another is a real harrowing deal for the medical care system.
It's a real challenge. What we do is partner up. The fact that we're able to move within our system is probably lessens the challenge so much that they're already in the patient database, but we can move them from one facility to another, and what we're doing is involving our hospitalists at each location. They're there 24 hours a day, 7 days a week. They're the ones determining the ability of these patients to be able to tolerate the move and get them to the nearest definitive care site.
So tell us just a little bit about what happened here. It looked like we got one wave and then another wave of patients coming in here, and a lot of them had glass in the face and all these really bad traumatic injuries.
The building imploded, parts of the building were damaged, and we had to respond accordingly. We had not only folks visiting their family members in the hospitals, but also our patients that were there. We got some of the injured the injuries are secondary to their hospitalization.
A lot of these are very vulnerable populations, okay? Why don't you explain to us what a vulnerable population is, particularly in emergency critical care?
In this instance, we have a long-term acute care facility that a lot of the patients there are on mechanical ventilation. And we were able to reach out. We have the capability at WellStar Keystone Hospital to be able to take them into our critical care areas. We have respiratory therapy, and we've got the necessary means to provide them with mechanical ventilation once they arrive. So that's as long as they're able to tolerate the move, because they are not, the patients at the long-term acute care facility are not as sick as the ones that you would find in a critical care setting in an acute care facility.
Okay, well, thank you, Bruce, for what you do and for coordinating between all these different hospitals and making it happen. Thank you.
Thank you, Dr. Dallas. Appreciate it.
Okay. This is Dr. Robert Lubitz, who is the Vice President of Medical Affairs here at WellStar Keystone Regional Medical Center. And I'd like to talk to you, Dr. Lubitz, about weather events. We're doing a big exercise today at your hospital, and we have a big weather event. How relevant is that?
Well, we are doing a big exercise, and it's all across our region. Weather events are very relevant when it comes to safety and security of our population. A storm can cause devastating effects to property, to people. If they hit large cities, there can be multiple casualties and injuries. So hospitals need to be prepared, as do whole regions of hospitals, to accept trauma victims as well as the worried well and the mildly wounded.
Well, WellStar Keystone is the regional coordinating hospital for this region. So how do these other hospitals in this area, how are they looking to you for leadership in a crisis? Now, we're just doing an exercise today, but in a real event, they'll be coordinating with you in order to determine how to treat all these surge of patients.
Well, we perform the way we practice, so simulation exercises like this are very important. Kennestone Hospital will serve as a regional coordinating center for the other hospitals in the area. So if there's a large surge of patients that come in, we're able to not only absorb those here, but if we begin to have our system stressed, we can call upon the other hospitals in the region to accept patients who have been injured or need surgery.
How do you coordinate that? Will you find out how many beds you have and how many beds this other hospital has when all of these people are showing up at your hospital?
Each hospital has a command center that's set up to manage an incident like a tornado or other major weather event. They are able to track their number of beds and available resources, and we report through a software system that everyone can review at the same time. So Kennestone Regional Medical Center takes a leadership role in observing where beds are available and then begins to assign patients to those areas and those hospitals as are needed.
So, Dr. Lubitz, what makes this hospital still available after all of these events have occurred? How is this an island in the storm that people can come to? How is it protected?
As a regional trauma center, our facility is built and staffed to manage just about any major disaster. So we're structurally hardened so we can withstand major events that occur to the hospital. And then we have the staff, equipment, and supplies to be able to manage surges of patients that come through for just about any emergency.
Let's break from today's exercise to clarify some terminology. Emergency support functions describes a grouping of governmental and private sector support, resources, and services that will most likely be needed and coordinated in the event of an emergency. There are a total of 15 emergency support functions. Today's drill concentrates primarily on ESF 8, Public Health and Medical Services.
Now we're outside the hospital at the mobile command center for this region with Matthew Crumpton, who is the healthcare coordinator for all of the hospitals and the healthcare system for the state of Georgia in doing these exercises, getting ready for mass casualty events. So Matthew, why don't you tell me, how does this fit in with the overall view of exercise preparedness in the state and in the government?
Well, like we all know, all exercises as well as emergencies start locally and then ramp up from a local response to a regional response, and then ultimately to the state response, and then a federal response. And so the operations center behind us is a district asset where the regional coordinator as well as the emergency coordinator for the public health district are able to see everything happening and communicating with all the different entities, healthcare and emergency support functions throughout this area that may be impacted by disasters.
The emergency support functions, such as ESF 8, which we're doing right now, are part of a bigger network. Why don't you describe this emergency support function that we're actually exercising now and how it fits in with the other emergency support functions?
Well, as you mentioned, ESF 8 is public health and medical care. And as we all know, healthcare is really a community effort. It starts off with ESF 1 transportation, because without transportation assets, we can't get the patients from the field back to the healthcare facilities. As well as the other emergency support functions, we finally realized that we're all in this together, so that if we don't have a coordinated effort across all the platforms, then we're vulnerable for devastation and not being able to recover our communities quite as quickly.
So in addition to this exercise going on right here at this hospital today, how is this fitting in with other hospitals in this region and across the city of Atlanta right now?
Well, as you mentioned, we're doing the exercise here at this one hospital facility, but there's also a lot of other hospitals throughout Metro Atlanta, which is Regions N and Region D, which encompasses all of Metro Atlanta and about 8 counties. But it's not just the hospitals that are doing the exercises today, it's also the nursing homes, the hospital health care, for a lot of them have home health, and of course we have the ambulance transportations, as well as other responders, including the National Guard. And this exercise is a culmination of 9 months worth of planning, and we have over 80 different agencies from Metro Atlanta involved in the exercise today. Fire departments, police departments, also local sheriff's department, as I mentioned, the National Guard, and then all the healthcare coalitions are involved in this exercise, all the way from district public health down to the local county public health, and then the hospitals as well as nursing homes are involved in this effort, all practicing their disaster plans so that they would be ready to respond for the citizens of Georgia should the need arise.
You know, Matthew, you're with the Department of Public Health here in the state of Georgia, and you've told us about all these different groups that we're coordinating with. We're also coordinating with the federal government, which provides funding for this, and they have guidelines for how we should conduct this kind of exercise and this kind of research, really. Tell me how we're adapting to new federal guidelines as this whole process evolves over time.
Well, in the very beginning, it was the hospital preparedness program. And very quickly, we realized in Georgia, even before the federal guidelines changed, that hospitals can't do it alone. So we changed it to the Healthcare Community Preparedness Program, and which now is the federal model. And they've came out with new guidance and different capabilities, which is very important for our coalitions as new terms that we're using here in Georgia.
Okay, now we're with Alexandra Duff, who is a master's in public health student at the University of Georgia Institute for Disaster Management. And Alexandra's here as an evaluator. Okay, tell me, what's that like? What's it like to be thrown into this whole world of emergency preparedness and what's going on in this hospital?
Well, it's actually really exciting. We've talked about it in class multiple times. We've done different trainings, but it's really nice to see it all together and put in real life. And not only that, I'm like evaluating the hospital and seeing what they're doing, but also I can use the information I learned today future on and when I have a job after graduation.
Tell me, what is a hospital evaluator? What are you doing in that role?
Well, we're just kind of watching what each of the different positions are doing in the incident command between the different sections, whether it's the logistics or planning, finance, and watching what they're doing and how quickly they're doing something and how slowly they're doing it. And just making sure that if it was to be a real life event, how quickly it could help get to where it needed to be.
And so you're also going to write up a report, aren't you? Okay, it's called an after action report, which helps people understand where they were doing well and where they can improve.
After the exercise, we're going to have a hot wash, so everybody inside will kind of give their overview of what happened and where they think there could be improvement, and then all the evaluators together will put in their notes, and then a report will be conducted.
Well, that's why we're doing it, is so we'll be ready when the real thing happens. Okay, thank you very much. Alexandra Duff.
So we're winding up our exercise for today. It's taking place all across Metro of Atlanta. We've had approximately 40 healthcare facilities participate to some degree. Some of them have been directly impacted by a tornado where their facility has been hit and they've been compromised and had to evacuate. We've had some other areas where just the community has been impacted by tornadoes and they've just been sending victims to these respective healthcare agencies.
All right, so we had all these hospitals interacting with each other. How well did it go?
We think it went very well. I mean, this is always a learning process, and that's the reason that we're here, is to learn from this process, addressing any gaps, addressing any operations plans that may need updating, identifying areas within our facilities where we need to improve so that we can provide better care to our citizens in a disaster.
Okay, in just a few minutes, you're going to be directing a hot wash where we get everybody together while everything's still fresh in their minds. How does that go?
And this is the best place for us to gather information. This gives our players, it gives our participants, it gives our evaluators a chance to really identify those areas that went well, and more importantly, those areas for improvement that we have to work on. So it really is an open environment. It's designed for constructive criticism only, and so we're going to learn a lot in our hot wash coming up.
To wrap it up, why do we really go through the considerable amount of effort here to do these large-scale exercises?
For two main reasons. The first of which is it is a regulatory requirement. Our hospitals are required to conduct 2 full-scale exercises every year. The second reason is we do want to protect our citizens. It is really for our citizens so that our hospitals are better prepared when a disaster strikes, not if.
Well, thank you for the effort that you've done. Dr. Kurt Harris, Associate Director of the Institute for Disaster Management.
Thank you.
Wow, Cham, that was really interesting to see how the healthcare professionals, including public health, all come together to respond to a natural disaster.
We're more prepared, and it's because we're bringing all these different people together and practicing for the unexpected.
So I think what you really demonstrated today was how coordinated public health needs to be. And it brings together public health and health care and EMTs and hospitals, and it's that practice that really gets us prepared for these disasters.
That's right, Phaedra, and we really like to thank Kennestone Hospital and the Georgia Hospital Association, and especially the Department of Public Health, along with all our other coalition partners, and really coming together in emergency response here in the state of Georgia.
And we'd like to thank you for joining us on this episode of PHI Public Health Impact, and we'll see you next time.